So let's move on to Kootenai Health. Here we have a hospital in town, right? So do you think that Kootenai Health should have stayed a community hospital with elected board, or do you agree with their decision to become a nonprofit?
Okay, good. Legislature made a decision over there. They thought it was a no-brainer, and this is something that we have to know what the heck they're doing. So they created a 501c3, and there was 2 bleeding heart liberals down there, but the whole entire legislature approved it and adopted it. That's because they were ignorant about what was really going to happen. The ramifications of 501c3, those people can do whatever they darn well please now. Thank you very much, you miserable legislators.
Well, I have not studied the community health. Probably that Masterson has a good idea on this. So I would decide not to say yes or no on that until I found out more about it.
Tough question, but let me just give you a little bit of history about Kootenai Health, because I think it's important to understand that. In the state of Idaho, there are several hospital districts, and they're divided up into small quadrants. For example, the Silver Valley is a separate hospital district from Coeur d'Alene, separate from Bonner County and Boundary County. Those are critical access hospitals. Kootenai Hospital is their support force. Okay. When I worked in the ER, I was also a critical care transport nurse. Flew on helicopters in the back of the ambulance. When a patient came to shown and could not get adequate care, they came to an ancillary hospital, which is Kootenai Health. If Kootenai Health goes private or was taken off the rolls, they don't have to maintain that. They do not have to accept patients that they don't want to. You can see that by just have a condition without insurance and go try to get into multi-care in Spokane, which is the old Deaconess Hospital. Okay, that is was a district hospital for a reason. That's a support hospital. When that hospital can't provide care, those patients go to a bigger hospital. When I was a case manager in the ER, we battled back and forth all the time with the governor of Washington and the governor of Idaho, whose Medicaid was going to pay for that helicopter flight over there and who's going to pay for their hospital stay. Because if it didn't have that arranged ahead of time, that patient was not going. And that's what will happen right there if that is all changed. Okay? It needs to stay a district hospital. It hasn't been on the tax rolls since I don't even remember when they took it off. It was quite some time ago, and then it got put back on. I'm sorry. So it got taken off of the tax rolls, and if it changes, it's going to go back on. So anyway, I think that we need to leave it as it is.
I believe it was a huge mistake to turn it over to a 501c3, but way before COVID, forgive me for any people who worked at KMC in here or Kootenai Health, but in my opinion, it's no worse than our public education system. It is a horrible experience going into Kootenai Health. It was even before COVID, and what they proved through COVID was they don't care about your health. And so I have begged people, stop going to Kootenai Health, go somewhere where the doctors and the staff cares about your health, and they will do what they can to help you. If I'm dying, I would rather die on my way to Spokane somewhere than go to Kootenai Health.
So I'm opposed, or was opposed, it's too late now, but I was opposed to that changeover. It should have been kept in. It was paid for by the taxpayers. It was self-funding, so the taxpayers weren't paying taxes on it for a number of years. But it's the taxpayers' property, and they should not have been able to get their own majority to go do that. I don't know why the board was set up where there was only 3 board members that were basically elected. That would have changed a lot of things, even like the COVID. I have a daughter that was working there, and you know, the people that didn't get the vaccination or that got the, well, they all had to wear masks, but they were discriminated against. They got moved to other departments. They got shunned by managers. And I talked to one board member that tried to make a motion to stop the mandate, and he couldn't even get a second. So the board was not controlled by the taxpayers, and that was where the mistake was. And it should have been run by taxpayers. To me, it's like the URDs that are appointed. You know, instead of us taxpayers doing a bond to pay for the overpass on Greens Ferry across the interstate, they decided to do it. They used tax money, and they weren't elected. So all of these facilities should be run by elected officials.